Folks, we're going to talk today about the alcohol dependence syndrome. I'm going to talk to you about the definition, and then I'm going to try and explain it in simple terms.
In 2008 I had my last admission, which for me was vital because my health was deteriorating through alcohol, and luckily I got admission to this unit, Ward 15, and the staff, through their tough love and their care, which I have to say, because their care, I mean, it went further than just the therapy room. They genuinely cared, and then they introduced me to the Fellowship of Alcoholics Anonymous, which is vitally important. I use the hospital here as often as possible to the meetings they hold on a Tuesday night, the meetings they hold on a Sunday morning, and I attend a ladies group here on a Monday morning. It's great for me to come back to this ward because it's where I started and where I found hope. My life is great and I owe it to here.
We've successfully been able to improve outcome matters, particularly in the first 6 months, doubling the percentage outcome. We were previously looking at sort of 20% people staying clean and sober in the first 6 months. We've now got that figure doubled, and that comes by various interventions of medications. It comes from family supervising medications at home, and it also has been very successful when people don't have that family support network to come to the ward, and we've had as many as 12 people coming up to the ward here on a daily basis, getting the medication, but not just getting the medication, but getting time to talk to members of staff about any little problems that come their way.
Because I was receiving supervised medication, I was able to come to the ward every morning. And that was great because it first of all gave me a purpose to get up in the morning again, to build a routine into my life. But it gave me access to the nursing staff to be able to, you know, if I had a difficulty or I wasn't feeling just the best, to ask for help. And indeed, you know, I continued to receive that service from the hospital, even though now I've moved back into the family home. I believe it's actually an extra service that the staff have offered me as more like an outpatient to still receive that medication from the nursing staff.
Alcoholism is known as a family disease. In terms of physical, we can see it from the outside, and from the inside, we affect the major organ to be the liver.
Every research paper coming out looking at the impact of treatment says involve families. So without any additional resources, we had to look at how can we do that. So we put our heads together within a team, and we came up with an idea that we wanted to test out. You know, one day a month, inviting patients to invite a significant member of their family in recovery that would support their recovery. And what we wanted to do was build resilience, both for the patient, but also for the family member.
I got involved with Shimna House in 2008. My daughter was admitted with a dual addiction of drugs and alcohol, and I was introduced by the community to the relatives group, where we come every Tuesday night and to support our relatives, to learn myself how to cope with it, you know, because addiction affects the whole family, everyone in the family. And by coming down here, I've learned the ward has given me not only my daughter back, my family back, and myself back.
We have a very strong affiliation with ex-patients, and we have many people that come up here Sundays and Tuesdays. And I saw an opportunity for those folks to come to the ward and to talk to the patients about their time during their stay and what things they had to do to get into the recovery from the day that they left the ward.
When I was in the ward, people came and took me out to go to meetings of Alcoholics Anonymous. I was impressed by why people would do this, and I really got a lot out of it, and it helped me in my journey into Alcoholics Anonymous when I left the ward. So I made a decision. I had many things to change in my life, and one of them was that I would, when the time was right, give a commitment to come back to the ward and do similar for patients who are in now. So I do that every week. I come down and I take the patients who are in their first week to a meeting of Alcoholics Anonymous, and I find that a very, very rewarding thing for my recovery.
I do this to stay sober. I do this out of gratitude. If I don't give this away, I can't keep it. And that's it. They've told me that from day one. I owe my life to Ward 15, I owe the quality of my life to Ward 15, and I keep coming back in appreciation for what they've done for me.